Hello, everyone. I am here today with Savannah, and we are here to talk about her practice and what her counseling looks like at Alliance Counseling Group. So, hi, Savannah. How are you today?
Hi, David. Doing great. Thank you so much.
Great. I was wondering if you could tell me your official designation, your license, and some of that good stuff.
Yeah, absolutely. I am LLPC, and I work in the Grand Rapids area, both in person and via telehealth. Love the community here.
Love it. All right. I would like to know, where did you go to school?
Yeah. For my master's, I went to Northwestern University, located in Illinois.
Heard of it. Some of us familiar with the Big Ten may have heard of it. What did you think of the program? What stood out?
Yeah, the main thing that drew me to that program, among being just high academics and a place that I could trust the accreditation and quality of education, was also their engagement with and commitment to a more multicultural approach, making sure that we are getting diverse experiences brought to us, and where it's not just one voice that is being highlighted, which I thought, in a practice where I don't want to be listening to only one voice, I should probably make sure that I'm getting that sort of broad education.
Oh, that makes me think of so many other questions. Like with a multicultural emphasis, how do you think that training, what does a training like that emphasize? Because we're all humans, so like learn psychology for humans. But when you emphasize multicultural, like, where does that take you?
Yeah. I mean, especially since I tend to gravitate towards trauma work, that changes everything. So all of the systems that probably we don't have full control over right now, that have informed your trauma, or the culture that is going to always be so integral into how you understand yourself and the people around you, how you interact, and the messages from your world, and how you learn to adapt in your culture is going to be very different depending on your family, your race, your sexuality, your religion. And so I want to be in a position where I can listen humbly, and I am always pursuing learning more on how you experience the world, so that I'm not just imposing one way of understanding your trauma and then having like one right way of reprocessing that. I think is super important.
Wow. So not only the influence on the systems that impact you and that you sort of participate in, but also the challenge for you as an individual to hold those systems, but also try to understand how, maybe fill that in. Like, how does, like, when you put that emphasis on multiculturalism, I think, right, thinking about the systems and some of those unique contexts that individual is in. But then as a therapist, how does that challenge you? How does that influence you with the multicultural approach?
Yeah, I think it's something I'm always wanting to keep in mind. Like, if I have a woman in front of me, I want to explore how her gender identity and her upbringing maybe has impacted or felt like it has limited her in some way, and make sure that we're able to empower her and her beliefs and her options without dismissing the impact of her upbringing. Because again, it's not like we're in an isolated little bubble and everyone has the same experience, and so they're going to process it the same exact way. That's important.
Does Northwestern teach a particular theoretical perspective?
Yeah, they tend to lean towards more psychodynamic, which is kind of evolved out of psychoanalysis, more compassionate and holistic view of that. Me personally, I kind of have adapted that for a more eclectic approach. I like psychodynamic, but I also like to pull in some IFS work, narrative work, and for those like good coping skills after we've gotten to understand you and give compassion towards you, some DBT is really helpful.
Excellent. So tell me, who, with that training and that approach, where's the magical fit? Like when you're talking to a particular demographic, where do you feel like that gels? I don't want to say who's your favorite client, right? Because that's not fair. you love everybody, but
Yes.
in the gelling, like, oh, I was trained for this.
Mm.
What are some of those clients like?
Yeah, I think I'll go general first, and then I'll get really specific to
Love,
that.
love it.
Generally, just anyone, couples or individuals who are willing to engage and give compassion to, and then challenge their most vulnerable feelings. Because it's tough work, it's loving work for yourself, but it is hard. And so acknowledging that that's a part of the process is really helpful from the get-go. And then getting more specific. I really have a passion for working with complex traumas, dissociation, personality disorders, or also like the ADHD flare. So
Lots of follow-up questions, but that I probably need you to first tell me what's the ADHD flare?
that's anyone with ADHD or traits in general, even if there's not a formal diagnosis. I just tend to click better with those individuals. It tends to be a more automatic fit when they're in the room. Not that I can't click with individuals who are very neurotypical. That's all right.
Okay, so what a lot of people might think ADHD. Why do I need counseling? I need some medication to sort of deal with some of my symptoms. But what am I going to talk about in counseling?
Yeah, I mean, I think people assume that you get one pill and then it's all good and you're fine, and not realizing how far-reaching that has impacted your life, likely with relationships, impulse control, likely having more of a hard time being able to manage just different activities throughout your life. So we can work through time management, some organizational skills, communication, and this can also create some sensitivities in your life, in relationships, and in work, which can be hard to navigate. And love to be able to provide some education and compassion and some skills to be able to make that a little easier for you.
Use the relationship word again, and that just wanted me to call back. Couples counseling is something you've said is important to you.
Yeah.
What is it like to do couples counseling, Savannah?
With me for couples counseling, it is a lot of the, again, like you're gonna have to be vulnerable, which is really tough, but it's good stuff in order to be able to show up fully for yourself and for your partner, um, emphasizing that this is not just a one-sided issue, and so we're going to have to accept the impact that the other person has on us and the impact that we have on them. And so I love being able to engage with both individuals in the couples counseling and help them communicate better as a team. And they always give great insights for one another too. So you have to be a little brave.
Yes, I find that when couples are looking for counseling, that we have communication issues.
Mm-hmm.
But it sounds like there's an opportunity for self-awareness and for how the self impacts the relationship. And so it's maybe more than communication skills.
Yeah. Yeah. It's always kind of a feedback loop of your relationship with yourself having to do with a relationship with someone else. And that just, it keeps flowing, and learning how to maybe get a translator and learn how to speak their language a little bit better, one with more connection and care.
Personality disorder and DID. Though we should tell people, us counselors say DID, but want to say more about that?
Yeah, so DID, dissociative identity disorder, it used to be called like multiple personality disorder. That is a super evolving disorder, very misunderstood in the past. And I love being able to engage with people where it was just a way of coping with some really, really difficult situations in their life. Oftentimes there's abuse and pain or trauma that it came out of. And so one, being able to explain, normalize their experience, and to where it's not so stigmatized, make sure that any messages that have come through that are difficult, being able to process that and maybe reshape their story, and feeling more empowered to reconnect their different parts of themselves or alters and feel more unified and confident in how they're experiencing their own life.
Do you have any opinions about how that multiple personality disorder, that name got changed to dissociative identity disorder?
Yeah, I think multiple personality doesn't really encompass the wholeness of the person, because it's not like you are actually several people. You are still one person, and it describes the broader symptoms that are present in that disorder. So dissociation in general, that's kind of an umbrella term. So you'll be experiencing, there's depersonalization, derealization, and then you've got the identity piece where there's like that fissure or fracture in your sense of self. And so I think that tends to be a more accurate and less stigmatized or misleading label.
How much, when you're working with a client with trauma in their background, do you, like, the dissociation is a common symptom?
Very common. So even if it doesn't meet full criteria for, let's say, DID, it's really common even if you don't meet full criteria for dissociation, like the derealization or depersonalization. This can show up with PTSD pretty frequently, and people might not even recognize that that's what's happening, as a way of, oh, my body doesn't feel safe right now, and so my body's going to protect me, and I might not feel very present. I might feel outside of my body or trapped in my body, and whatever's happening around me, I don't have to be present to experience that fear or that trigger or a very active threat too. And so it's kind of an amazing thing that our body does. And so even though it's hard, and now when we're wanting to get out of that survival mode, like, and trust that we are safe, it's still doing that. But one of my favorite things to do with clients is first be like, okay, can we thank our body for what it's been doing for us? I know that's hard and it's confusing, especially now when it's impacting functional living. That's really tough, but being able to understand and give compassion towards how our brain and body has been doing the work for us and caring.
When we work with clients, one of the reasons why I love to be in these conversations with other clinicians is sort of get a sense of what it's like to sit in a room with you, because the door closes and we're doing counseling. But are there other modes or techniques that modalities that you like to use when working with clients?
Yeah, first, just getting to know your story is really important. I don't need to know the nitty-grittiest details. If you don't want that, that's okay. We can go nice and slow, and just to where you're able to be heard. Some of these stories, it's the first time that you're sharing them, or it's the 1000th time. And no matter what, that's okay. I just wanted to make sure that you know that it's valued and that there's a safe space whenever you're ready for that. And then after we've kind of in the middle of that process too, or wherever we're ready for some more challenging of that, I want us to be able to identify patterns that we've seen. What messages were we getting? What were we learning? Whether it was said or we were just actively absorbing it, even if it was unspoken. Did you feel loved? Did you feel responsible for the people around you? Did you feel empowered to make your own decisions, or did you not feel like you had a voice or a choice? Did you feel respected? And so kind of learning these themes, or what we might call like schemas, and that kind of helps us know, how have you processed yourself, people around you, the world around you? And then that also tells us, okay, that's likely influencing how we're behaving then, or how we're responding to this stress. And so now, how do we want to reshape that, take control of our own narrative, and kind of learn new coping skills or ways of responding? You know, you might not have to be as defensive, or you might not have to put up those walls in the same way. Or almost the opposite, you might need to learn how to put up safe boundaries to protect yourself, and knowing that that's okay and that's going to be all right, even if people are upset by them.
Oh, that's so helpful. Is a good match with you? I'm thinking about like, I like what you're saying, but do you feel like there's an age limit that you are good with? Do you want to say anything about that?
You know, I think there are so many people who have their own little niches, and I think with how I conceptualize therapy for me in my workplace, it tends to take a lot of introspection and some self-awareness. And so I tend to work best with ages like 15 through adulthood. And so just because it takes kind of a higher, more abstract thinking too, we like to work with metaphors and get into all of that. So it tends to be late adolescence through adulthood.
I love hearing all of these things and hearing how you show up in the room, working with people. Is there anything else that, looking through a list of counselors, is there something else that we should know about you that would stand out or be a distinctive that would be different or unique?
Sure. I would say advocacy is really important to me. So if you want someone who is both doing work in and outside of the session, that is something that I'm constantly trying to improve on and be active. I have a corgi, so if you like dogs, sometimes in telehealth sessions, he might pop up. Otherwise, I also love feedback. So if you don't like what we're doing, or if you want something a little different, to the best of my ability within it, who I still am, I try to accommodate that. If you like homework or don't like homework, we can switch that up, whatever you need or want.
So I'm very grateful that you take this time to talk about the work that you do. I'm grateful that you do this work and can show up for people and take them through an intentional process to heal relationships and heal themselves. And so thank you. I'm really grateful.
Thank you so much, David. Appreciate it.
All right. We'll talk to you later.
Thanks. Bye.